we've invited 4 of the 8 schools that took on my challenge, and they're here today to present to you what they did. We're very excited to have them here. So our first school is I think you're Magnet High School from South Los Angeles. So I have to tell you, the students are all teaching me how to do selfies. They're teaching me how to do photo bombs. I learned all this. Then we have Teacher Prep Academy, or Caesar Chavez Learning Academy. Another selfie. Reseda High School from the Valley. They're here. And finally, if I'm not last, we have the Valley Academy of Arts and Sciences. So I'm going to have each of these schools come up, and they're going to present to you what they did. All right, Reseda. So we have 2 students representing Reseda today.
My name is Thomas Colmeyer.
Good afternoon. My name is Josue Menden.
And we represent the Reseda High School Aspen Challenge team. February 8th, the Aspen Challenge. After hearing 6 presentations at Cesar Chavez Academy, the group was indecisive as to which challenge we would tackle. We had narrowed it down to 2, which a 6-week solution would need to be built upon. One of them being Dr. Ortega's challenge to identify and change knowledge, attitudes, and behaviors towards an important public health problem in our community. Monday after, driving to school, listening to National Public Radio, I heard the now familiar voice of Professor Ortega. He was discussing research in the East LA community and addressing a population's unhealthy dietary choices. After getting over the shock of hearing on the radio a man who I had just met 2 days before, my curiosity was sparked as to how relevant his research was to the population of Reseda High School. Minutes later, I arrived at school and watched the students holding, eating snacks, and fast food descended from their school buses. Walking through the gates of our school, books in one arm, soft drinks in the other. The sight was the final push I needed to confirm Professor Ortega's challenge was the one most relevant to our school's community. It had to be the challenge we accepted and solved to transform our own community to a healthier lifestyle.
Good morning, Reseda.
Before coming up with a solution that we were now calling Reseda's dietary disaster, we needed to understand our population. 1,785 surveys were distributed at Reseda High School. Faculty received a specific number of surveys, and each student had an equal opportunity to answer 17 questions in 15 minutes. 898 surveys were completed, reflecting this cross-sectional representation of our student population. The Western Association of Schools and Colleges reports that there are 32 different cultures at Reseda High School. Our hypothesis was students with different ethnic backgrounds would have different dietary choices. Consumption, as reported through the survey, would reflect household cultural backgrounds. Results show this couldn't be farther from the truth. Our first metric was recall. Respondents' list of 10 vegetables would indicate popularity and exposure. Only 52% of respondents could even recall 10 distinct vegetables. And this was spread across all 6 ethnic identifications. For all the diversity and ethnic experience of our school population, it came down to this.
When I was a student at Reseda High School many, many years ago, we had vending machines on either side of the doors of Regent Hall, and you could probably even see the spot because they were there for so many years. And they had apples. And it was like 10 cents probably because it really was a long time ago. And they were the best apples ever. And they were cold, and it was like one of those times when you would really eat an apple because it was so refreshing and delicious. I don't know why they disappeared, but certainly it's something that could be done. I don't know what other kinds of things you could put in a vending machine that wouldn't be processed food, but I know the apple machine worked because it was here. We used to make the best mashed potatoes in the world from real potatoes. You know, they boil them and mash them like your mom does, and they're really, really good. So we had mashed potatoes, and that was actually my favorite because I'm all carbs all the time. But I think that, you know, now in our cafeteria, they don't cook any of the food. The food gets shipped to them from a central kitchen, and then they just warm it up. So anytime that you're cutting out the actual preparation of food, you're going to get stuff that's processed and stuff in those little containers that doesn't look good and doesn't taste good. Or it tastes like it's been in a container for a long time.
While graphs based on different ethnicities reflected different ideologies towards eating, each ethnicity had a common trend. Around 40% of the subjects from each ethnicity claimed they eat fast food once per week. The greatest outlier was the fact that 30% of our African American population identified having eaten fast food more than 3 times a week. Almost twice as our entire sampled school population. This provoked us to look deeper. Of the 143 African American students at Reseda High School, 52% qualified for free reduced lunch. Also, 66% of the total population requires the school bus as transportation to school and back. Food available in and around school may be all these students can get at. If the school serves food that is unappealing to the students, this may drive them to purchase alternatives such as processed food from vending machines and the fast food restaurants which encircle our school. A positive correlation between eating processed food and socioeconomic status, availability, and one more metric was developing in our findings. Time. Most groups overwhelmingly state the main reason for eating fast food was that there was no time to cook. Time spent away from home cooking. Time when options for healthy eating are absent.
Whatever. I don't like it. I don't like it.
I think it tastes really disgusting. It's gotten really bad.
School food?
Yeah.
Well, I don't buy school food, but from what people say, it sucks. I mean, half the stuff doesn't even look like it's real. For instance, chicken. I mean, it's not supposed to be like slimy. So, you know, it's kind of nasty.
It's gross. Well, sometimes the food is good, but it depends. Mostly they're kind of nasty. Even though they try to be like nutrition and stuff, it's not appetizing.
They should have more vegetarian options.
They don't have anything vegetarian.
Because I don't eat anything ever.
And that's
Like today, I had, they barely have any options. So.
And the people that they don't have time in the morning to make food, like lunch for themselves, and then they come here and they don't like the food.
Yeah, it should
like
be more
then they don't
fresh.
eat like the whole day.
Because it's so packaged and processed. It's kind of gross.
School food, well, I mean, you can, you know, go back to all the budget stuff. I mean, I guess put some money into, you know, food. Let's see. Maybe they can, I don't know, buy fresh ingredients and actually make the food themselves instead of, you know, buying prepackaged goods. Because, you know, prepackaged goods. I mean, who likes food in a can? Come on. Unless it's pineapples. Why can't we have, you know, pineapples in a can? Come on.
Yeah, bringing back some of the old food they took, or at least bringing back strawberry and chocolate milk.
Yeah.
What do you usually purchase from the
I get like granola bars.
I get Cheez-Its. I don't like the hot Cheetos either. I don't like anything. It's bad.
So you get the granola bars. Why do you get the granola bars and why do you get the Cheez-Its?
I like Cheez-Its. I like it. I don't know. That's the only thing I can eat here. Really.
I don't know. I just like granola bars better than.
If there were fresher options in our vending machines, would you eat those? Like a vending machine that sells apples?
Fruits?
Oh
yeah.
Yeah. I was
Yeah, I
actually
would do
talking
that.
to my friend this one time, like, why don't they give out like fruits in cups for like the cafeteria food, like fresh fruit? I think that would be better
Even the
than
fruit they have here is
crappy.
not good.
Sorry, I'm just kidding.
Any of them.
Yeah, lately.
And what do you usually purchase from the vending machines?
Corn nuts and hot Cheetos.